guys, welcome to this video on the types of depression. 5% of the world's population that is reported suffer from depression. Depression is incredibly difficult to bear and can feel dark and lonely. Not only does it cause emotional turmoil, but it also puts people at risk for heart disease. It is not something that should be thought of lightly, and if you're undergoing changes in mood or changes in thought patterns that last for over 2 weeks, it may be best for you to speak with a doctor or mental health professional. In this video, we will talk about several different types of depression. Major depression. Major depression is one of the 4 most common types of depression. In this state of depression, one will feel a devastatingly heavy, overwhelming, and debilitating mood of gloom and blackness. Someone with major depression experiences loss of desire for activities, including activities that they would normally find desirable. An exact cause for major depression is unknown. However, many health professionals believe that it may be due to chemical changes and imbalance in the brain. These chemical changes may be due to genetic mutations, a series of highly stressful events, or perhaps both. Symptoms of major depression include loss of energy, fatigue, frequent crying, increased worry and anxiety, changes in weight and appetite, difficulty sleeping, and feelings of emptiness and worthlessness. Persistent depressive disorder. Persistent depressive disorder refers to a state of depression that has lasted for at least 2 years, but is not experienced at the same magnitude as major depression. Someone with persistent depressive disorder is able to take part in daily life activities, but feels lifeless and unhappy the whole time. A few corresponding symptoms to this depression may be changes in appetite, a struggle to sleep, lower energy, low self-esteem, or feelings of emptiness and hopelessness. Peripartum depression or postpartum. It's not uncommon for many mothers to experience what is commonly referred to as the baby blues after giving birth. This could look like mood swings, feelings of sadness, feeling overwhelmed or anxious, spells of crying, trouble sleeping, or changes in one's appetite. However, the baby blues are generally gone within a few days to a week, and treatment is not necessary. Postpartum depression includes symptoms that are much more severe than the baby blues and also last much longer. A woman with postpartum depression may begin to feel empty and worthless, and she may lose a desire or interest for her baby. It is common that women with postpartum depression struggle with thoughts of wanting to hurt themselves or the baby. In rare cases, mothers will begin to hallucinate and act on those thoughts and hurt themselves or the baby. This type of depression can take place starting anytime within the first year after the mother has given birth. Women who have experienced depression any time before getting pregnant are at higher risk. Seasonal affective disorder, or SAD. Seasonal affective disorder is a type of depression that occurs during certain seasons, then passes. It is most common during the fall and winter months. SAD may be due to the reduced amount of sunlight during the winter months, although some experience SAD during the spring and summer months as well. People with SAD may have an imbalance in serotonin, which is a hormone that affects your mood. They also may produce an excessive amount of melatonin and a deficient amount of vitamin D. Depression symptoms of SAD may include sadness, carb craving and weight gain, fatigue, irritability, feelings of emptiness, lack of desire to do things one used to enjoy, trouble sleeping, and thoughts of suicide. Psychotic depression. Psychotic depression exists in someone who has severe depression as well as a form of psychosis. This psychosis may be in the form of hallucinations or delusions. Hallucinations could be hearing and or seeing things that others cannot see. Bipolar disorder, formerly called manic depression. A person with bipolar disorder will experience episodes of depression. They typically have really high highs. However, this manic stage is not sustainable and leads to self-destructive behavior, which is generally followed by a stretch of depression. Another type of depression that is unique only to women is premenstrual dysphoric disorder, or PMDD. This is an extreme form of premenstrual syndrome, or PMS. PMDD is known to cause extreme and even debilitating symptoms that get in the way of daily activities. Symptoms generally begin after ovulation and end as soon as the menstruation starts, so basically during the second part of the woman's cycle. Symptoms include headaches, bloating, breast sensitivity, joint pain, frequent mood swings and crying, irritability, panic attacks, and fatigue. Issues with sleeping and anxiety, though more rare, have been reported as well. To be diagnosed with PMDD, you must have 5 or more of these symptoms. Disruptive mood dysregulation disorder. Disruptive mood dysregulation disorder, or DMDD, is a condition only diagnosed in children. It is characterized by severe irritability, intense tantrums, and raging anger. DMDD goes well beyond a few episodes of child moodiness. DMDD is only diagnosed in children between the ages of 6 to 18. Symptoms of DMDD include irritability throughout the entire day, most days, 3 or more unexplained verbal or behavioral temper tantrums within a week, and an inability to function in most settings due to irritability. A child will not be diagnosed with DMDD unless the symptoms are consistently present for a year or more. I hope that this video has been helpful for you. For further help, be sure to check out more of our videos by subscribing to our channel below. See you guys next time.